provided by the Well-Led Practice. Great to see so many of you again, familiar faces, and again some new faces. I'm Dr. Claire Sieber and I run the Well-Led Practice with a lovely team that you will meet shortly. As I said, this is our third webinar now, focusing this time on the Freedom to Speak Up quality statement that sits under the Well-Led key question. Our other two webinars on inclusivity and, remind me, Gabby, what's the other one? Setting direction? Are available on our YouTube channel if you wish to watch them. And this recording will also go on our YouTube channel afterwards, and you'll also have an opportunity to get the slides. So don't feel like you need to make copious notes. Everyone who's on the webinar right now will be emailed all of that stuff afterwards. So you'll get it automatically without having to ask. So what we're going to do today is our usual kind of structure for these webinars, where we'll introduce you to this third quality statement. And Gabby will give you some recent examples from CQC inspections on what providers are expected to be doing and what is looked upon less favourably by the CQC. And then we'll put our former practice manager and our current GP partner in the hot seat for a good grilling by Gabby. And then I'll take over at the end and just run you through the Well-Led provider platform a little bit and how specifically we think it can help you with the Freedom to Speak Up quality statement and also the Well-Led key question in general. And we'll have some time for Q&As at the end. The chat function is open and so is the Q&A function. So feel free to start typing in stuff as we go along, but we will use it at the end as well. So I'll let my team introduce themselves first. Gabby, would you like to go?
Great, thanks Claire. Hi everyone, nice to see you all again, or for those that are new, welcome to the series. So my name's Gabby. I am currently doing consultancy work in CQC compliance and quality improvement and quality assurance across the health and social care sector, and my background is as a CQC inspector. So I was working with the CQC for about 4.5 years doing inspections, and prior to that I've worked in CQC regulated services, so hopefully have a little bit of experience from both sides of the coin.
Thanks Gabby. Gary.
Hi everyone, yeah, I'm Gary Hughes. Good to see some familiar names in the list of attendees. I was a practice manager for 13 years and also director of the Federation and Primary Care Network, but I now do consultancy. I work with the Well-Led Practice, have done for over a year now or thereabouts, and just supporting practices and PCNs where I can. Thank you.
And Ketan.
Oh, hi, I'm Ketan, a GP partner of 16 years in West Herts, also locality lead, and have recently been through a CQC inspection myself.
Thank you, Ketan. So we will pick your brains on that one a little bit later, if that's okay. So you're ideally situated to help us with that one. And then, as I said, I'm Dr. Claire Sieber. I'm a practicing GP down in West Sussex. And about a year ago now, we founded the company, the Well-Led Provider, which is also known as the Well-Led Practice, with my colleague Oscar Matthew, who is a barrister by background, but now works with healthcare teams facilitating and mediating. So that's us and where we're from. And I'll hand over to Gabby now to start running us through this quality statement about freedom to speak up.
Great, thank you. So so for those of you who have dialed in previously, we're looking to capture just the data that the CQC are publishing throughout the year. So hopefully by the end of this series, we'll have a bit more of an understanding of the rate of inspections that are happening and how that differs across the healthcare sector, so for GP practices compared to residential homes, as I know we do have some people in the audience who work in adult social care as well. So this is purely just to give you a little bit of context as to where the CQC are at and how they're pushing forward with their new single assessment framework. So we can see that in March this year, we've had 81 GP practices that were, well, not inspected, but had their reports published. And we can see that nearly 1/3 of those had a rating of either requires improvement or inadequate, which is quite high and something worth holding on to, and hopefully being able to take some learning from this to improve or drive quality improvement across the services. And As usual, there's no real change in terms of the outstanding ratings. They're always a very low number. So we had 2 GP practices that had an outstanding rating and just 1 care home that received that rating in March this year. So low, but not unexpected in that sense. And hopefully we can focus on the areas of good. And then here, yeah, we've just got the 2024 so far. So you can see again that the GP practices, the rate in which they're being inspected in comparison to adult social care is nearly 50% less reports that are being published. Again, the stats don't differ really, you know, nearly 1/3, and then a very low number of outstanding across the year. So as we move through each month, there's nothing particularly different compared to the months, you know, each month at a time. But it's just worth, hopefully worth seeing that and holding on to in terms of knowing where the CQC are at. So we will dive into the quality statement. So we're having a look today at Freedom to Speak Up. Just to make you aware, when you receive the reports, that blue arrow there is actually a hyperlink directly to the Freedom to Speak Up quality statement on the CQC website. So that will take you directly to the notes, and it will also take you, there's also a hyperlink attached to that that takes you to the independent review of Freedom to Speak Up that was published in 2015 by Sir Robert Francis. So we are going to have a look in detail at the Francis report today, but just to make you aware, it is over 100 pages long, and it does actually set out 20 principles and actions that aim to create the right conditions for the NHS, for NHS services to get Freedom to Speak Up right. So we won't be able to obviously dive into all 20 principles, but throughout the Q&A with Gary and Ketan and through some of the other slides, we're going to have a look at some of the elements that are picked up in there. And it's important just for those in the audience who aren't from an NHS service that although the report is focused on that, there are of course many areas that can be transferred to primary care and adult social care in the independent sector as well. So there is learning for everybody. So when we look specifically at this quality statement, the top box that we have is the overall statement that the CQC have given us to go with. So what they're saying is that we as a provider foster a positive culture where people feel that they can speak up and their voice will be heard. So it's not a huge sentence, not a huge amount of detail, but that's the overarching statement that they've given us. What we can then see below is the kind of subsections that the CQC are pointing us towards. So in terms of research or having a look at how that's broken down, the subtopics for each quality statement are listed below. So they're going to be looking at your Freedom to Speak Up Guardian. They're wanting to have an understanding about how you manage closed cultures. They want to look, and they'll be inspecting on the culture that you create in terms of freedom to speak up from a culture and inclusivity perspective. And then they'll also want to understand about your whistleblowing processes as well. Just to remind you that, so some of this information that we're seeing throughout the presentation is also taken from a Mythbuster on the CQC website. For those of you who aren't familiar with the CQC Mythbusters, they're really helpful. Sort of, they are what they say on the can. They're kind of demystifying some of the misunderstanding that we might have, or the more complex statements that we come across within the CQC framework or within an inspection framework. So if you're ever in doubt about something, just feel free to Google CQC Mythbuster, and then you can type in your specific query and it will come up. So there is a Mythbuster specifically dedicated to freedom to speaking up within GP practices, which is quite helpful for people. So as we move through, this here is some information about what we're looking for when we think about a Freedom to Speak Up champion. You know, I'm sure all of us have had many conversations about the specific roles, the responsibilities that they will have to take on, what that looks like in day-to-day practice, thinking about the training that they might need, thinking about the funding that they might, that might be needed behind that, thinking about how it might impact on their day-to-day other roles and responsibilities that they have. So when the CQC are looking at your Freedom to Speak Up champion, they're really looking for some of these key points here. So the role should, for example, make sure that there is appropriate training on how to speak up for the whole workforce. So it's not just something that is held at management level or held by the particular champion or guardian that you've got. that information would expected to be known and understood, followed, and hopefully encouraged by the whole workforce, regardless of who it is that they're speaking to. Again, they would expect the Freedom Speak Up champion to respond to members of staff who want to speak up, and then they would actually have to individually manage each case. So we will, I think that Gary and Ketan have got some thoughts on that later, and so have Claire, about how that looks, but that is worth considering in terms of the case management and, you know, the level of complexity that could come up depending on what it is that they hear from other staff members. They'd also be looking to produce regular reports for their senior management team or the board where needed. So again, when you're thinking about your Freedom to Speak Up policy, when you're thinking about your existing governance processes, for example, the audits that you might be having, the frequency of your practice meetings, how regularly you're discussing the running of a service, the expectation would now be that Freedom to Speak Up is embedded into that. So how often, for example, are you receiving those reports? What lessons are you taking from that? How are you then embedding those into the culture or the running of the organisation moving forward to hopefully prevent recurrence of anything that's come forward, and to drive quality. Another example, I won't go through all 6, but another one could be for them to understand and promote the speaking up culture and enable the speaking up processes and strategies to work well. So again, that's having a little bit more of a strategic vision or role within the organisation, within the service. It's not just about, being quite task focused and working in a tunnel vision way and thinking, this is my job, I'll just get on with it. It's how do they know that the whole organisation understand the processes and does it work well? So if you haven't had anything, that might be fine. It might just be that there's nothing to talk about. Or is it because the culture isn't right, the processes aren't embedded and people don't understand exactly what the policy and the procedure is? So it's really, as I mentioned, taking a bird's eye view and being able to think about how the practice is running from the top down. So if we move on to the next slide, please. Thank you. So we've got here the related legislation. So for all quality statements that you'll come across under the CQC, they have actually then provided us with the associated Health and Social Care Act regulations. So we know exactly where we stand now from a compliance and a legislation point of view. So we've got the Regulation 17, which looks at good governance. We will come on to that later in terms of how you can evidence this from a policies, procedures, audits, paperwork perspective. The quality statement also covers safe care and treatment for obvious reasons. It's about creating a safe culture within the workforce. And then looking at dignity and respect and person-centred care. So we've got some best practice guidance. Again, this is all from the CQC, so they're providing us with this information, but the expectation would be that your Freedom to Speak Up approach and your policy and your way of working would link directly to some of these or all of these best practice guidance, so they're worth having a read of as well. And just to say on this one really quickly, here that all organisations that provide services under the NHS standard contract are required to appoint a Freedom to Speak Up guardian. So although not compulsory, the National Guardian's Office expects primary care provider organisations and all other health and care leadership organisations to appoint a Freedom to Speak Up guardian. So GP practices can work with other practices in the area or with other stakeholders, their primary care network or the ICB to achieve this. And I think that's something that Ketan will shed some light on for us later. But each NHS primary care provider should have systems to ensure that staff know who is the named individual Freedom to Speak Up guardian. And it's really important that that person is independent of the line management chain or the GP partnership. And as we've spoken about, the Guardian's role is to make sure that the policies are implemented and that staff know exactly who to contact if they have a concern, which is why it's really important that that role is independent and impartial from the existing team. So here we have a little bit more detail for you. We touched on the 4 pieces of legislation that are picked up now under this particular quality statement. So just some extracts so you don't have to go away and read all of the legislation in detail. These are the extracts of those particular four pieces that are relevant to freedom to speak up. So, for example, dignity and respect, it might be something that you associate only with patient care, but actually when you break it down, it's looking at how providers demonstrate that they will take all reasonable steps to make sure that people using their service are always treated with dignity and respect. And there is, of course, a direct correlation between how you deliver patient care with how your organisation is run and how your staff are feeling. Do they feel that they're treated with dignity and respect? Do they understand the correct and safe processes to follow within the service? And again, we look at person-centred care, so Regulation 9. Providers here must take every reasonable effort to provide opportunities to involve people in making decisions about their care and treatment and support them to do this. So this may include involving people in discussions, inviting them to meetings, and encouraging them to ask questions and provide suggestions. So we can take from that as an example that if a staff member was feeling that that principle, that those approaches and those values weren't being adhered to, then that might be a reason to speak up and raise concerns about the culture of the organisation and how well led how the managers are driving a well-led culture. So if we move on, thank you. So as Claire mentioned, and for those of you who have been part of this series so far, I tend to have a look at the most recent published reports and have a look specifically at some extracts that have come in relation to the quality statement that we're looking at. So what was really interesting about this one is you may have, for those of you who joined previously, I've often been able to pull quite a lot of extracts from the reports and sometimes too many to fit on one page. So we've had to decide on just maybe the top 2 or 3. But I did really find it difficult this month to find extracts from reports that were relevant to freedom to speak up. So it's not us being lazy by having not as much on the page. It's actually because it's probably a reflection on the shift that the CQC are now taking. Freedom to speak up previously, although it formed part of the framework, it was never its own individual quality statement or area that was an isolated area for inspection. And interestingly, now, for example, if you're going to register with the CQC for the first time, you do need a freedom to speak up policy, whereas previously that was never part of the initial request to register. So we can see that the CQC are really framing their new framework around this quality statement, and that they're wanting to do a much deeper dive into how this looks in practice and making sure that services are getting it right. So for part 1, so for every quality statement, there will always be then a breakdown, so some kind of more subtopics that the CQC will be looking at, which we touched on earlier. And so for freedom to speak up, there are 4 areas that will be inspected. The first one being that staff and leaders act with openness, honesty and transparency. And the only extract I could find from many, many reports last month was that the practice encouraged candor, openness and honesty. So before we move on, it would be really worthwhile if anybody in the audience can use the chat function and hopefully share some ideas or some barriers that they've come across in terms of implementing this particular quality statement. Maybe share some top tips on how you've ensured that your leaders and that your workforce do act with openness, honesty and transparency, and in particular how you can evidence that. So as well as us giving you some top tips, it would be great if we could share in the audience as well. So if we have a look at part 2, there's a couple more here, which is a bit more helpful. So this here is looking at how staff and leaders actively promote empowerment to drive improvement. So they encourage staff to raise concerns and promote the value of doing so, and all staff feel confident that their voices will be heard. And I personally really enjoy this particular breakdown. I think it's fantastic that they're looking at how confident staff feel to voice concerns and to know that anything that they do say will not just be heard and then sort of put aside while the management team gets on with their own vision or their own action plan, but really that there's value in staff speaking up, in sharing ideas, in sharing potential lessons learned, and in driving that quality together. So I think it's really fantastic that this is being inspected in a little bit more detail now. So the blue extracts are from services that have had an outstanding rating last month. So the two that we saw, this is from their reports. So we can see the directors encouraged a no blame culture and staff confirmed. So it's really important, that word there, staff confirmed that they felt they could raise concerns without fear of blame. So the inspectors obviously had a conversation with multiple people across the workforce in order to verify that the directors have got that no blame culture. It's always about triangulation within the CQC, and it's when we're looking at people, we're looking at the workforce, and we're looking at your processes. So it's positive to see that the directors have obviously said this is how we work, and staff have been able to confirm it, and then the processes that they've looked at have verified it. And another example is staff at all levels were actively encouraged to speak up and raise concerns. So directors spoke regularly with all members of staff on a formal and informal basis, and staff told us they had confidence that any concerns raised would be addressed. So we can see there that the key theme in those two is actually that staff have verified the culture of the workforce. As I mentioned, it's not just about what we pick up from management, and it's not just what we pick up from your processes or your policies, but actually how do the workforce feel, and can they reassure the CQC that this is really how things are. So part 3, we've got an inadequate extractor requires improvement and another outstanding for you. So this here is looking at the making sure that there's a culture of speaking up where staff actively raise concerns, and those that do are supported without fear of detriment. Obviously, a really important part of it being getting freedom to speak up right is making sure that staff feel safe to do so, and that when concerns are raised, leaders investigate these concerns sensitively and confidentially, and that lessons are shared and acted on. Again, really important there to focus on sharing lessons, not just keeping them to yourself as a management team and creating your own internal action plan and moving forward with that, but really making sure that your workforce know, okay, this is what you've told us, thank you for that, this is what we hear, this is what we're going to do with it, this is how you have ultimately contributed to a better service being delivered for the workforce and for our patients. So an extract from an inadequate report shows that staff we spoke to told us that the Freedom to Speak Up Guardian was the practice manager. So we know from previous, as I've already mentioned, and from existing guidance, that it's not okay for them to be an internal member of staff who sits on the management team, because it, for obvious reasons, it doesn't provide staff with an independent person that they can raise concerns to. So that immediately goes against providing a safe and effective culture within the service. And then it requires improvement. So a small number of staff felt they were not always listened to, or that messages were not always received as well as they could be. So again, although it's just a small number, it's still not enough to get you a good or an outstanding. It needs to be the whole workforce that they're speaking to, and the CQC must feel confident that as an organisation or as a service, you've really got that right across the board. And then if we have a look at part 4, again, so not much, but hopefully we can share some ideas on this. So when something goes wrong, people receive a sincere and timely apology and are told about any actions being taken to prevent the same happening again. So we've got one, that when people were affected by things that went wrong, they were given an apology and informed of any resulting action. So nothing too groundbreaking there for you, but it's essentially the service is delivering what the CQC are asking for from a compliance, from a legislation, from a best practice point of view. So again, if you've got any ideas or want to share any thoughts on how you've managed that process, it would be greatly appreciated for others in the audience. So just before we move on to the hot seat questions, we've just got a little bit of a grid here for you to take away and hopefully use to support you in terms of evidencing compliance to the CQC. We know that's a question that comes up often is, you know, there's one thing saying we do it, but how do we prove it? Or how do we upload that to the portal for the CQC? Or how do we reflect it when the CQC speak to us? So just to help, for those of you who aren't familiar, that under the new framework, there are 6 evidence categories, that the CQC are looking at. And particularly for freedom to speak up, these are the 2 that they will be inspecting under. So as we've seen through the report so far, and we've seen through the guidance that's been published, they want to hear from staff and they want to hear from leaders, and then they want to back that against the processes that you've got. So for example, you'll want to be making sure that you've got your Freedom to Speak Up Guardian, your Freedom to Speak Up policy, and your revised reporting policy. So just to reiterate, that should not distinguish between reporting incidents and making a protected disclosure. So you need to have those two things well considered in terms of your reporting policy. Making sure that the Freedom to Speak Up Guardian, but also all of your workforce have participated in training. So it's a bit like safeguarding. You know, there might be certain levels that some staff need more than others, but everybody needs to be aware of it. Making sure that you have accessible information to staff, for staff to know who the Freedom to Speak Up champion is and what the process is. Again, not just some dusty old policy that's sitting around and people haven't had an opportunity to read, to engage with, to maybe be a part of updating. It needs to be accessible. Thinking about your induction process. So for any onboarding or for new starter, how are you making sure that they are introduced to the Freedom to Speak Up Guardian and to the processes? And that also includes non-permanent staff, so any agency staff that you're using or locums, etc. Everybody needs to have that embedded into their induction. We mentioned earlier about the reporting processes, so thinking about how you receive reports, how frequently you do so and what you do with them, and how regularly you might be meeting with your Freedom to Speak Up Guardian to understand the culture and the climate of the service. So again, as we've mentioned, it might be a case of you're meeting once a quarter and actually by quarter 3 you're thinking, we haven't had anything, we haven't heard anything, but we know that our workforce aren't happy. Or for example, when we speak to our workforce, they don't know about this process. So the dots aren't joining, something's not aligning. How can we get this right from a culture perspective? And then, as I mentioned, making sure that for any reports that you do receive, any incidents that you're made aware of, having a really robust analysis and then implementation of change and a lessons learned process in place. So those are all things that you can then evidence to the CQC that you're doing in order to meet this particular quality statement. So if we move on, and hopefully now it's time for the questions. And I can see that there's a couple of questions that have come through in the chat function. So when Claire has an opportunity to talk about her thoughts, then we can have a look at those and hopefully we can all shed some light for you. So question number 1 for Gary. Hi, Gary. So yeah, as I mentioned throughout the presentation so far, we've touched on the Francis report, which does have really high level, a lot of recommendations for people to think about. So yeah, we won't be able to go through them all today, but we're touching on a few as part of these questions, and hopefully everybody will get a chance to read it, even if it's just the exec summary at some point after this presentation. So question number 1, due to the level of detail available in the reports that we've seen, we don't know what staff are referring to when they say messages were not always received as well as they could be. So as a practice manager, can you reflect on a time that you didn't receive messages from staff in the best way? And what do you think some of the factors at play were? What could you have done differently?
So if I think back to my time in practice, and quite often what happens typically in practice is messages can often be very very relaxed and casual in how they're sort of relayed. It might be scraps of paper, or you get little or scant information, or you're told as you pass by. So that can be a real issue, and often that can be that there's not the systems and processes in place to do these, to relay the messages properly. But if that happens, then it's going to be that you haven't got enough details to act on things. There's no audit trails. You need to have the evidence, and you need to go back to look at things in hindsight, and look back at things for investigations. And I think the factors for these are often that it's workload pressures. Certainly in my time in practice, that was a big thing. But it can often be that just there's not the right system in place to actually be able to sort of relay and convey these messages. And I think the other big factor is psychological safety as well. People don't feel safe to actually make those, to be able to raise these issues. If I think about how I could have done things differently because I certainly didn't get it perfect. I think all the things I've talked about, that was absolutely true. I think, if I were in practice now, I would be making sure that there are some systems to be able to, confidently and making sure that you can do that with full psychological safety, raise messages as it's going to be out of the practice, you know who you've got to go to. So I think a big thing for me would be making sure there's psychological safety, but also understanding of what actually this is about. What's the process that's going to happen? What does the freedom to speak up mean? Why it's important? So I think for me, it would be about making sure the systems are in place. People have got psychological safety and they've got full understanding of what it's all about, what it means, what they need if they're relaying a message, what is the important information, what's going to happen with it. I think that would be important for me.
Brilliant, thanks, Gary. Yeah, and I think that's really important that you've picked up on, in your when you were previously a practice manager, about the systems and the processes. So sometimes information can be heard in quite an informal capacity, or as you're passing on your way to another meeting or to another, another urgent situation that you need to deal with. And I know that in previous webinars, we've actually spoken about how managers can be more present when receiving difficult or sensitive information, and this ties into it quite nicely. It's, how are you making sure that you as a practice manager or you as a leader are in the right space to potentially receive information that's difficult, or to receive concerns, or make your workforce aware of what the processes are. And it's also really interesting as well, often when people think about processes and they think about systems, that's usually the boring part of a job. We're here to support patients. We want to work with our service users in the community. We want to improve outcomes for individuals. We don't want to be thinking about, well, a lot of my experience shows that we don't really want to be thinking about the behind the scenes paperwork, but actually having a robust system in place is really, really important in this particular area, and making sure that all of your staff know what the systems are, so that things aren't just missed, or one person receives a different response to another person, because that there does need to be continuity and consistency in this particular area. So thanks, Gary. Okay, question 2 for Ketan. So Principle 10 of the Francis report highlights the importance that every member of staff should receive training in their organisation's approach to raising concerns and then receiving and acting on them. So do you provide this at your service? And if yes, what benefits have you found as a result?
So where I am currently and where I've been before, we've made it part of the induction pack. That's actually a good place to start. And I think actually that's developed as an approach, because initially it was part of multiple documents, and it can actually be quite overwhelming that this is who you contact for HR issues, rota issues, and actually it just gets easily forgotten. So that then became quite obvious that nobody was really using it initially. When you start doing your staff feedback, which is anonymized, and there are some surprises in there, and you think, why has that not been raised before? And the initial reaction might be, well, actually it's just one person, or it's 2 people, or actually it might just be a trend, and that person has felt the courage to actually speak up in that moment. And so you need to pay attention to it, you need to look into it. Is this a one-off, or is this a trend? So actually we've made a bigger deal of it in the induction. That's the first thing. We have clinical meetings or target days. These are highlighted, and really it is about a feeling of, if I speak up, is that going to come back to haunt me? Is there a way that it will come back? And just like you have a line manager that you can speak to, but you might not be comfortable about certain issues because of potential repercussions or personality or so on, there should be somebody else who you could speak to. It could be inside the practice. We at our practice have somebody inside the practice and somebody completely external as well, who they have access to. And that's been quite beneficial, as now the anonymized feedback tends not to have many surprises. So you can see it's working well. And I think one of the questions, and it's not just feedback, but what is your feedback and how are you asking the question is really important. So feeling comfortable enough to bring up issues is a question that we really highlight as being important. We need to know that if it's a no, then we have a problem, and it will be usually our method of communication as to how easy it is. But you need to remove barriers, and ultimately, if it's a happier place and people feel safe in the working environment, it will add up, and you'll get more back in spades.
Brilliant, thank you. Thanks, Ketan. Yeah, that's really helpful. You've reminded me actually, and I've also seen a comment from Claire. Thank you, Claire, for sharing some ideas in the chat about the staff feedback. So part the appraisals, the supervisions, and the staff surveys that you've also mentioned, Ketan. So they weren't included in the evidence grid on the previous slide, but they would also be really good ways of not just showing the CQC, but understanding for yourselves as a leadership team, how do our staff feel about Freedom to Speak Up? Do they understand the systems and processes? And I can see that Claire's also, for example, spoken about the focus on well-being, which has been documented, and then staff have been able to explain the issues they're having, the actions and changes have been made, and that staff appreciate that. So the appreciation for the appreciation to be acknowledged means that it's working, and that's really good evidence in itself. So good reminder, Ketan and Claire, about the importance of staff feedback as well in the different ways that you can capture that. So I think there's a question for you, Ketan, here. So live, can I ask Ketan, who is the external person the team has access to, and where do they sit in structures? Has there been any evaluation of the numbers using internally or external routes, and the reasons why?
So internally, we ask people to volunteer for that role, and it just so happens to be one of our salaried doctors. And externally, it is another practice manager from a practice outside the locality, but still within the ICB. So someone who's familiar with local processes and so on, but isn't aligned to us. We try to minimize any conflict of interest, and just kind of elaborating on that a little bit. In view of this report, ICBs, I know our ICB is looking into that role as practices are actually going to be asked to have this documented on application. So they're looking into formal training for that role, and perhaps even making it a paid role in some sense. So that's to come, and I'm sure that will develop nationwide.
Brilliant, thank you. Okay, so if we move on to, thanks, Lorraine. So Lorraine said that's really helpful. Thank you, Ketan. So if we move on to our third question for Gary. So looking at Principle 7 of the Francis report, talks about the importance of having structures to facilitate both informal and formal raising and resolution of concerns. So where do you think the line between formal and informal lies? That's a really tough question.
Because nobody ever told me what's formal and what's informal. And still now, nobody has ever told me what's formal and informal. And I suspect I'm probably no different to most people in practice. It's something you have to decide yourself. Now, for me, if it's informal, you're probably thinking about things that, what can I deal with without recording it? What can I deal with quietly? What can I deal with without any further disruption? What can I just deal with, and then we can continue as we are without any extra work? Whereas the formal things, we probably feel, we think about things that, okay, this is going to be part of the disciplinary or a grievance procedure, or it's a formal complaint. It might be something, maybe you might be thinking formal, okay, there's another party involved, or that there's going to be some reporting or recording that's a requirement. So I think for me, that's probably how I would think of it and distinguish between the two, and probably how I always would have done. In saying that, I suspect as well, you get issues, and there's probably a tendency to think, what can I deal with informally? Because it's easier. I can save work, but that might not be right. I think in hindsight, it's better to consider everything as formal or with a level of formality attached to it. You never know when something, might have been brought very informally, but at a later date might be escalated. So you might be asked to refer back to that first starting point where it was quite informal. You might, need to check previous facts. So having the records and things is important. And I also think if you are treating everything formally or with a level of formality to it, more likely to have consistency as well. So making sure that there's a policy and process in place. So, that's a good starting point that lays out what is formal and informal and how you should do it. But yeah, that's how.
Yeah, it was a tough question, so thanks Gary. And I think you're absolutely right that there's no one definition of formal and informal, and it is for services to decide how that would look. And I think it's a really good point that you made about sort of being proportionate with your response to, you might not be able to deal with everything formally, but there is potentially a bias to wanting things to be informal because it's less work and because it's less of a burden on you and your team. There are only so many hours in the day, and thinking, oh, if I can just deal with that informally, it'll be gone and then I don't have to worry about it. But actually that might just be one of many informal pieces of information that you're receiving, or it might be a reflection of sort of, things that are bubbling under the surface. And if they're not dealt with in a proactive and potentially more formal manner now, you might have a much bigger problem or issue or, concern on your hands later down the line. So it is about finding that, being proportionate and finding that balance between the two, isn't it? And I think we can all relate to sometimes, in any sector, whether it's on the phone to BT or Virgin Media, saying, oh no, I don't want to make a fuss, but actually this isn't good enough. And it's how we get rid of that within health and social care, and actually nothing's a fuss and everything's important and everything's valuable. So yeah, some food for thought. Don't have the exact answer, but it's some good food for thought. So thanks, Gary. Okay, last question for Ketan. So Principle 17 of the Francis Report recognised that one of the most vulnerable groups when raising concerns are non-permanent staff. So what tips can you do, or what tips could you suggest to ensure that this gap is closed?
So this is obviously actually a more vulnerable group and a tricky group to actually have the same processes, but it does overlap. So locums should have induction packs anyway of what the processes are in the practice. And when you highlight the important points, just like when you go around with them on their first day of where the fire exits are, etc., this is something that's highlighted as well. Same processes, same person that they could speak to within the practice and outside the practice as well. And actually, that's really important because it all develops around what culture you're trying to create. So whether they're actually somebody who's there for the day or a regular non-permanent staff, they still need to feel the same. And actually, you'll probably get more insights into somebody who isn't there that often than somebody who's just used to the way things are, but didn't really see certain things that maybe they should have been raised and they haven't been raised. So it can be really insightful to get that. And if you start to develop that from an early stage, somebody will feel comfortable, because we have to remember that these people are actually far less secure, because they might think, if I bring something up, will I be employed again? Will I be asked to come back? And so they probably feel even less safe. So it's really important to kind of get that message out. If you do have people who are not permanent but do come fairly regularly, you can make them part of your training, target days, kind of update emails and so on. There are people, for example, in some practices who only do extended hours, and that's the only time that they're in contact with the practice. That can be quite lonely, and actually they may not see anybody that they see regularly, and so they need to be aware of the processes and kind of feel in the loop more than anything else. So that's what we've done, and that's the kind of feedback that we try and look for. If possible, and it isn't always possible, if somebody's there on the day, we do try and align them with somebody as the first port of call if there is anything that they're worried about. And that necessarily isn't about speaking up as such, but it could be anything of, where the kitchen is, where the toilets are, anything, and they just feel a little bit lost. Having somebody there that they can just message or go and knock on their door is really useful as well.
Brilliant, thanks, Ketan. Yeah, some really good, good food for thought there as well, isn't there? And And it is, yeah, it's really interesting that was picked up on as one of the most vulnerable groups. And I know from my time as an inspector, and now when I'm out doing inspections and speaking with staff, you sometimes can get the most insight. You're right that you said that, Ketan, from agency workers or locum workers, because they will have seen lots of different services. They'll know what good looks like, sometimes more than you will, because you're so embedded in the way that you're working. And they'll also know what poor looks like, and they will maybe be able to express that or discuss that in a different way to permanent staff members. So there is often a lot that we can learn from those people that are kind of moving between services. And thinking about exit interviews could be a really good opportunity to pick up what their thoughts are. It doesn't have to be as extensive as a permanent member of staff for obvious reasons, but there might be some questions that you can ask them as they're moving between services. Okay, how did you find the culture in terms of sharing, learning from each other, disclosing sensitive information? Did other staff members have any issues that they didn't feel able to raise? So there are ways that you could probably learn from them just as much as they can hopefully learn from you. So yeah, good. Thank you, everybody. And I think we've just got one more question before I hand over to Claire at the top. So
I could take it if you want, Gabby, when I talk about doing my next bit, if that's all right. Get you off the hook.
Yeah.
And then that means Gary and Ketan, now you can now cool off from your hot seat. I do a lot of clinical locuming at the moment, so I agree with you with this whole thing about how as a locum you get a feel for places and you can quite quickly work out whether you're in a good place or a place that's struggling. I'm not saying that we're snitches or anything, but it is a kind of sense that we get. And the other thing that locums get when they experience a practice, which is fairly unique, is that from the sort of point that they're first engaged right through to the very end when they're sending in invoices, they liaise with all the sort of departments or teams within your practice, from the secretaries to the receptionists, the medical staff, finance team, in a different way than perhaps a salary GP would do. And so there are lots of things sometimes that we could spot. I really love it when I go into a new place and I get a nice welcome. Here's your room. Here's the toilets. Here's the kettle. Most importantly, here's all of the stuff you need to know. Bang! But it's also really nice when you get a little screen message popping up from one of the partners saying, "Hi, thanks for helping out today. Any problems, just shout." And it takes them 10-20 seconds to write that, but it really means a lot to me. And it makes me feel that if there was an issue, and sometimes I have, I'll message back and tell them about something or ask for some help about how to do an administrative task. It really makes a difference. So that's one thing I'd encourage any GP partners on the call to do if they're not already doing it with their locums. But I had some thoughts that kind of sort of high level summarizing thoughts of the discussion that we've had so far. Oh, crumbs, what have I done? And we're in quite a unique situation in general practice or in the care sector, in that our organisations are small. We're not big like these NHS trusts. We don't have very many staff members. Some small practices, for example, are running an organisation with under 10 members of staff. And so that this issue of keeping things confidential and feeling you can truly report something anonymously is a very live issue for our staff members. It might be that there was an event that only maybe one or two of them were at. And so if something about that event is brought up, it's going to be one of those two to start with. So that's an extra kind of sensitivity that we have to handle. And there isn't anyone in our organisation that's not a kind of in our line management structure or an employee. So there is this whole thing about somebody being independent has to be somebody completely separate to the practice. And like Ketan said, his arrangement for the external person was that it was a practice manager, not from a neighbouring practice, one outside of the locality. Because I imagine if you got a practice manager from your neighbouring practice or one from within your PCN, you could say that person isn't independent because they know your leadership team. They might be friends with them and meet with them regularly. So to pick up on Solomon's question, which was the first one in the chat, Solomon was saying that their organisation has appointed 3 of their directors to be Freedom to Speak Up guardians. and what is the definition of an independent person. And I would say I'm a really big fan of massive amounts of clear blue water between things and keeping things as separate as possible. And I would say that to be independent, you need to have absolutely no conflicts of interests. And a conflict of interest would be somebody who's in that organization, is employing you, is line managing you, is profiting from the running of the business. So a director that's a shareholder, I think that's a conflict and not somebody who's independent to the organization. So if that applies to those three directors, I would argue, although this is just me arguing it, I would say that's probably not somebody who's independent. Thanks, Solomon. I think you've got the thumbs up there for that one. Brilliant. Okay. So those are kind of the unique situations that we come across. And as Gabby has so neatly put by giving us a summary of some of the evidence that has come up in the reports, you can't just say you've got a freedom to speak up guardian. You've got to show that people know there's one and that they're actively using it, because the CQC will always triangulate. You've got a process, great. Now show me, and I'm going to speak to your staff to demonstrate this. Now show me that they actually know about that process and are using it. So we need to think as leaders, are we actually modeling these behaviors ourselves? For example, are we speaking up when there's an issue? And are we sharing that we've spoken up and what we've learned from it? Are we creating that right culture? Are we making our staff know that not only can they speak up, and this is the process, but actually they should speak up, and it's the right thing for all of us to do, to speak up? And it's subtle, but there's quite a big difference there between telling people that they can do it and saying, look, we should be doing this. It's the right thing to do. This is how you drive improvement. This is how ultimately we get better patient outcomes and we all have a better day at work. So please do it. Are we doing that in our organizations? It's a challenge I pose to people listening to the webinar today. As Ketan mentioned, there are some ICBs that are commissioning someone to be the freedom to speak up guardian for all practices. Some LMCs do it as well, although I wonder whether they're truly independent from practices. But there are options out there for you. Go to another provider and ask them, or go to a federation ICB, see who's out there who can do it for you. I found quite an old but still useful policy that NHS England had written specifically for primary care whistleblowing, which has a nice policy in it, and it talks about freedom to speak up guardians. So you could, I would recommend reading that. As Gabby said, you need not only a whistleblowing policy, but a separate freedom to speak up policy. You can't combine them in one, so don't make that mistake when you look at that. But I thought that was a useful resource, as was all of the resources that are on the National Freedom to Speak Up Guardian website. There's loads of stuff, job descriptions, policies, protocols for the freedom to speak up guardians to follow when somebody does tell them a thing that they need to do something about. So that will save you a load of time reinventing the wheel, whether you're appointing someone or whether you're actually that person yourself. So I would use those resources. And then finally, just to talk you through our platform, the Well-Led Provider, and how it can help you specifically with this. I hope by now you're getting a feel for what we offer, and that our platform will help you to improve your teamwork, your leadership skills, whether that's you as an individual leader or you as a leadership team in general. Therefore helps with recruitment and retention, and it will help you with your CQC well-led score by gathering that evidence, and if you haven't got that evidence, then working on your culture to create it. But you could also use our platform and say, in your policies, this is one of the speaking up channels that we have. Not only can people go to their line manager or do this or put a thing in our comment box, they can also provide feedback on the Well-Led Practice platform that we use. And we also have the resources on there that if you feel you could be doing more to improve your culture of speaking and listening and learning, we have resources, exercises for you to do, team ones and individual ones, to work on that kind of background culture that we've said is so important. So, for example, some of the stuff that you can get from our platform is that you can ask your staff anonymously and confidentially, do you feel safe to share your views? Do we make you feel safe to share them? Do we make you feel able to talk about your mistakes? Do you feel able to challenge each other constructively when there's an issue? Do we as leaders take responsibility for when something goes wrong? Do you feel that we do? Do you feel that we investigate significant events well? And do you feel that we value the opinion of every single member of staff? And then, as I said, we have some exercises on there to get you started in your team if there's an issue that you identify. If you want to look at moving from shifting yourselves from a slight blame culture, which is the kind of natural thing that we go to a more learning culture. And instead of somebody saying to you, this thing happened, and you saying, okay, well, what are we going to do differently, or what's happened as a result? We turn it around completely and say, well, what have you learned from that as your kind of first question. We've got exercises about how you can use data and information you get from failures and mistakes and things that could go better to drive your improvement, rather than just using opinions of perhaps the more senior people in your organisation. And we have loads of exercises on there about how to increase the psychological safety in your workplace and make people feel able, not only able, but wanting to raise issues and speak openly with this kind of no fear, no blame culture. As I said, you're getting all the slides anyway, but if anybody wants to do a really quick kind of self assessment of your leadership team and get a feel for what it would be like to be a member of staff completing one of our surveys that we provide you from our platform, you can use that QR code right now and do it without having to give us any of your details. There's no sign-in required. And if you would like to give us some feedback, and we would be very grateful for the feedback, we do look at it before we do every webinar, and we hope to keep improving things for you, then please do fill that in, and you will get emailed the link anyway, just because you've automatically attended our webinar. But we'd be very grateful for you to do that. And here's some information about us if you want to chat, if you want to book a demo, if you want to get one of our free trials, or you just want to ask us a question, please do reach out and we will get back to you. Feel free to put questions in the feedback form as well, because we do respond to them individually if it's an actual question that you want to ask us. Have we got any more questions that have popped up while I was talking about all of that?
Not seen any, no.
No. I'll give the audience, you've got 3 minutes of your life back, or 3 minutes to ask a question, depending on which you prefer. So I'll just give it a moment to see if anyone types anything. Did you have any final thoughts, Gabby, Gary, Ketan?
No, I mean, I think it's been a great session. I've no doubt most people in practice find this a challenging area. Right? So I think this has been really helpful. Certainly made me think about how I would do.
Okay.
Yeah, I found it really, really valuable too, actually. Lots of learning from my side of things. You know, even from putting the slides together to then hearing from Ketan and Gary and other people in the audience, there's just, there's lots to learn, and always different ways to think about things. So thanks, everyone.
I think from my perspective, I think it all aligns back to what kind of culture you want in your workplace. And so if you have a feedback culture, it's it's a culture of one of improvement, and this is what this aligns to. So if you can get that from the induction, it's really helpful for everyone to think that way in your organization.
Yeah, thank you, Ketan. Last minute question come in. I love the last minute question from Annette. We use a local practice PCN practice manager. So that, I think that means a practice manager in your PCN, but not your own one, as our freedom to speak up guardian. Will this be treated as too close to be independent? So I suppose my first question then, maybe this is for Gabby, is, I mean, who's going to ultimately decide whether that's somebody's too independent? Is it going to be your staff?
I think it would boil down to lots of different. It would boil down to feedback from staff that we've spoken about. Do they feel that's independent? Are you assured that there is no conflicts of interest? Just from that one statement, it doesn't feel too close. But again, you'd need, I don't know, Gary's pulling a different face, so maybe.
Yeah, I think Gary, like me, is the clear blue water fan. And
right.
Practices in the PCN are profit sharing profit. They're running some services together. Right. It's kind of an extension of the practice.
I I'm imagining a situation where a concern is raised about an ARRS role that's, you know, employed by the PCN, and then there's a conflict there. Yeah, it feels too close to me.
There we go. Okay, that's helpful. Thank you.
What about your gut feeling, Kate? Too close or all right?
I think, well, I don't think I've got an answer, because there will always be a conflict depending on how far you want to stretch it. I think it's in the right vein, and so I would be okay with that from my perspective, because I think it's quite easy to say no conflict of interest, but practically, who's willing to do it and who is actually willing to take on that responsibility that people can get in touch with? That's the balance you have. So if that is the best you can manage, then it's a pretty good start.
Yeah, that's a fair point. This person might be a real champion of speaking up and be really well respected in your area for that kind of thing. And it's a lot better than, well, at least you've got a freedom to speak up guardian to start with, and you've made it external to your practice. You know, that's like Ketan says, we're probably being a bit critical there, aren't we? It's not a bad start at all. Thank you, Annette, for the question. I hope that's sort of given you some food for thought from us four heads bashing together.
Just to finally say, Annette, it might just be worth not risk assessing, but just making sure that you feel confident that that's independent. So like I mentioned, speaking to staff, so whether that be a staff survey, you know, a particular email blast that goes out about this particular topic, and if you've got assurance from your own workforce that it feels independent, then that's fine. But you want to hear it from them, so that, you know, we spoke about the triangulating and the evidence categories. It's probably not enough for you to feel that. You need to be assured that your workforce feel it too. So there'd be ways to sort that out, hopefully relatively quickly, and then you've given yourself an answer.
Yeah, thank you. I forgot about that, the classic risk assessment to get around the problem. Thank you, Annette, and thank you everyone else for being so engaging on the chat. I hope it was useful, and we will see you at the next one, which we will email you about soon. Bye everyone.